Hi, everyone. I'd like to welcome you to the Environmental Health Information session. Today's session will be presented by Dale Chen, the program head. Before we get started, I would like to read out this statement. The British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional territories of the Coast Salish nations of the Squamish, Tsleil-Waututh, and Musqueam. Okay, so today we're going to get started with Dale, and he's going to go over the introduction of the program, play a video. We're going to have a presentation and program overview, and then he'll go over the details of how to apply. And then we have a question and answer period where luckily we have Janice Pontes from Program Advising that is here to help answer your questions. Next, I pass it over to Dale.
Great. Thank you very much, Julie, for the introduction. So my name is Dale Chen, and I am the program head for the Environmental Health Program. We are actually changing our name in this coming term to the Environmental Public Health Program to for greater clarity as to what the program is. So, but before we get that, here you should see in front of you a poll for how did you hear about this program? Oh, hear about the session, I mean. So if you can go ahead and answer in the poll, that would be greatly appreciated. Great. Well, thank you very much, everybody. Can we move to the next slide, please?
There we go.
There we go. So we should start off with our BCIT environmental health video. And in our video, we'll see the lovely Zach, who is actually a local environmental health officer here in Burnaby. So if we could go ahead and watch the video first, that gives a pretty good overview as to what the program is.
Hey, I'm Zach. I'm from Fraser Health.
Pleased to meet you. Want to show you around?
Perfect. So today, I'm doing an inspection here at this food processor. We'll be looking at making sure that sanitizers are available, that the staff are following proper hygiene practices, making sure that coolers and other cooking equipment is functioning properly. So there's a wide range of things that we are working towards to make sure that food safety and sanitation are being followed closely. So I love my job because every day is a new day. I enjoy seeing the collaboration with our health unit and seeing their successes, because when our operators are successful, we're successful.
Our environmental health program here at BCIT trains students to become environmental public health officers or inspectors. And in that capacity, we inspect water systems, restaurants, sewage disposal systems, pools and spas, and we even do tobacco control, making sure stores do not sell tobacco to minors.
I chose to come to BCIT because it is one of the few schools across Canada that offers the environmental health program. The instructors are all previous environmental health officers, and that's great because they can give us a lot of their knowledge and their experience in the field, and they make everything that we learn, they make it really applicable to the job.
Here at BCIT, we work you hard. 2 years worth of very intensive instructions, and we offer a 3-month practicum to all of our students, and so they get their training necessary to become a certified public health inspector after they're done with us.
So in the end of the day, it's about healthy communities. It makes me feel good that I've done my part. I'm a member of that community, and we get to do it together, and that makes me proud to do my job, to be a public health inspector.
What is environmental health? I'm not sure if, presumably both those of you that are attending this info session has, done a little bit of Googling as to what is environmental health, but in a nutshell, it is public health. It is the aspects of our environment that affect human health that we are concerned about. So those people who are working as environmental health officers, they're also called public health inspectors. So if you think of something in your environment, such as your food, your water, the air that you breathe, the building that you live in, the soils that you touch, etc., those are all aspects of environmental health that gets covered in our program. So we're not as concerned about things like, environmental management, things about the trees and the plants and things like that. That is sort of indirectly going to affect human health, but we are more concerned about the direct human health effects. So that is in contrast to public health or acute care, where people are concerned about diseases that get transmitted between people. So how does one person transmit disease between another, or whether or not the person has already become sick? That is sort of outside of environmental health. So if you can see there in the picture, this is actually Christina, who is a graduate from a couple of years ago. She is testing the water at this pool facility. It looks like UBC actually, maybe. Outdoor pool somewhere, but she's testing the water and trying to figure out, is the water quality good or not? And that's one of the duties that environmental health officers carry out. Next slide, please. Program overview. So we are a 2-year full-time Bachelor of Technology program. We're actually changing that as well as part of our major change. We will be the program itself is not changing, but rather than calling it a Bachelor of Technology in Environmental Health, we will be calling it a Bachelor's of Environmental Public Health. So we are a 2-year full-time program. Our full class size is 26 students, so that means you will get lots of individual support. And there are 2 cohorts there's 1 cohort every year. So there's 2 cohorts on campus at any one time, the first-year students and the second-year student. And the program itself is entirely in person, and it's delivered through a combination of lectures, field trips, and labs. There is a research project in the second year as well that is more or less independent. And we also have a practicum that is a part of our program. So you do need the practicum to become certified as an environmental health officer. And we're actually the only school in Canada that provides or arranges that practicum for you. There are a few other schools that offer the similar program here in Canada. One in Alberta, one in Ontario, and one in Nova Scotia. Actually, 2 in Ontario and 1 in Nova Scotia. But as far as I know, all of the other schools, they would ask you to go out and find your own practicums. So then you're left applying to different health authorities to looking for that practical experience. So we do arrange that for you because of our relationship with the regional health authorities here in BC. So that is a really big bonus for our program. And next slide, please. So in terms of people that would make good public health inspectors or good environmental health officers, first of all, you do need to be a mature, practical, and assertive person. And what we're trying to get at there is, if you can imagine, when you're on the job, you will be going to different restaurants, you'll be going to different pools, you'll be doing all kinds of different facilities, anywhere from somebody's home-based hair salon all the way up to a big industrial site that has water systems or on-site sewage or something that you need to deal with. So it's a really wide range of people that you need to deal with. So you need to be able to handle those different situations, right? Most 99% of people are very friendly and they're happy to see you. But as we've seen during the pandemic, there is that a small percentage of people that are not happy to see you, and then they are like, we don't want anything to do with you. So how do you face those situations? How do you handle yourself in those situations? That makes a big difference in terms of the success that you'll find. Similarly, you might have to sometimes give hard messages. You might have to shut down somebody's restaurant, and that's their livelihood, and they're begging you not to shut them down because they've got a family to feed. So how do you handle those situations? So that makes that's what we're trying to get out in terms of maturity and being practical and being assertive. So you do need to be sure of yourself in order to do a good job. So most of the time you are working independently as a EHO or environmental health officer. So that is a big bonus, right? You're on your own, usually out in the field, going to different facilities. You're out and about most times. You're not stuck in the office most days, which is a big bonus as well, depending on what you like, of course. But there's also plenty of opportunities for lots of teamwork. Most health authorities have committees and projects that need working on. They'll ask for volunteers, or sometimes people get assigned, that kind of thing. And then, of course, as you mature into your career, there's opportunity to step up into non-field work, from leadership to project-based work, etc. So those are all possibilities out in the field. I myself came from the field, of course, from environmental health. I spent 8 years up in North, based out of Prince George, doing environmental health work, where I saw all kinds of those different things that I sort of just touched on. You do need to have good interpersonal skills. It goes with the maturity and the assertiveness. You need to communicate. So one misconception that students sometimes come in is you're sort of like they kind of think, oh, you're just going to go in and check off a checklist and hand the list over, and that's it. Whereas in reality, 90% of the job is convincing the operator to do the right thing, right? So you go into a restaurant and you see some minor issues, or maybe there's serious issues. How do you talk to that operator? How do you get them to make that change so that they don't keep on doing it again? How do you do it in a way so that they feel respected by you, that they feel that they're being heard, that they'll be happy to make that change for you, and that you're working on their behalf, rather than you ending up building sort of a conflict situation where they don't want to do that anymore, right? So that good interpersonal skills, good communication skills goes a long, long way in determining your success, the success that you'll have in this career. Not everybody comes into that naturally, but you do need to be willing to learn and to put yourself in sort of like, challenge yourself, put yourself into challenging situations so that you can build those communication skills. Not everybody's a natural communicator, but everyone can learn to be a good communicator. So it does take a little bit of effort there. And then, of course, good problem solving and good decision-making skills. That goes into, so you do, let's say you come to a situation that you see out in public, let's say you're at a farmer's market, you see some baked goods that are left out in the sun, and you kind of go, well, maybe that's not a proper way to handle those baked goods. So how do you handle that situation? A person who you might be within your legal authority to go, yeah, I'm going to seize all those bagels and I'm going to dump them in the garbage. Maybe you're in the legal right there, but is that a good problem solving skill? Is that good communications? You may have just ruined that working relationship between yourself and the entire community. Everybody's going to see you as sort of this food Nazi. I've heard that term before, right? And then no one likes you. And that makes a big difference in a small community, especially, right? Or you end up in the local paper saying how, oh, the local health inspector is terrible and it's really hard on a small business owner, that kind of thing. That, nobody wants to have that on themselves. So you kind of go, you're in a good situation there. How do you find a solution where you address the public health concerns, but you're also making everybody as happy as possible? Of course, you can't make everybody happy all the time. You do have a job to do, but are you handling the situation in a way as to make it a win-win rather than a win-lose, right? So again, that's the entire package that would be ideal for somebody going into this career. Next slide, please. So benefits of an EHO career, I touched on this already a little bit. It's a diverse, interesting job. You're doing different things every day, especially if you end up working in a smaller community. In the city here, it tends to be a lot of restaurants, of course, and a lot of pools and a lot of personal services. So things like tattoo shops, hair salons, nail salons, everything, any service rendered onto a person's body, basically, other than the medical ones that are regulated by a college. So you work with the public quite a bit. People do come into the public health office to ask questions quite a bit. people often come to you because they have nowhere else to go. So they want to ask questions, and hopefully you'll be there to provide answers to them. You're benefiting your community that you live in, hopefully. So you do have that sense of satisfaction as you're doing a good thing out there. You're not, you're not a used car salesman trying to just squeeze every last dollar out of somebody, right? You're benefiting the community. You get to apply your science background. So a lot of you will come from a science background, and you'll kind of go, what am I doing with my degree or whatever you may have? Seems kind of useless day to day. Well, this is applied science. This is you applying those scientific principles and trying to explain it in a way so that a member of the public can understand why you are asking for the things that you're asking for. Working outside the office, I touched on that. You're definitely not stuck in the office. There's some office work, of course, but you're definitely not stuck in there. And responsibility. You will not have somebody looking over your shoulder all the time. You're operating independently most times. Of course, there will be times where you have to call your manager or your supervisor and consult with them, but most decisions you will make on your own. And that's where all of those decision-making skills come in, right? So that is also a benefit as well. That you don't have somebody sort of just hovering over you, making sure you're doing a good job. The trust is put into you that you will do a good job. And, there are checks and balances for you if you're not doing a good job, of course, but you do have that sense of independence. Next slide, please. So employment, where do environmental public health professionals work? So most provinces will have health authorities or regional health authorities or provincial health authorities where the majority of the health inspectors are employed. So BC here, we've got, Vancouver Coastal Health, Fraser Health, Interior Health, Northern Health, and Island Health. They employ the vast majority of our graduates. So you're out and about in the communities being a health inspector. CFIA and the Public Health Agency of Canada and Health Canada also employ people. So Public Health Agency, they've got health officers at the border, on the cruise ships, that kind of thing. There are also our grads. Health Canada is often dealing with First Nations communities, Indigenous communities, that sort of thing. They also employ environmental health graduates. And in BC, we have the First Nations Health Authority, which was spun off from Health Canada, which serves a similar purpose. The CFIA, which is the Canadian Food Inspection Agency, also employs quite a number of graduates, but that does depend a little bit on your existing background. Do you have sort of a food sciences background? They prefer that, but we do have quite a number of graduates working for the Food Inspection Agency as well. And then independently for private industry, a lot of big food processors and grocery stores and restaurant chains have their own internal quality insurance people, quality control people, and they do hire our graduates as well. Typically, those jobs don't require you to be certified, whereas the government ones usually require that you become certified as a as a public health inspector. And then there are sort of independent private consulting firms that do audits as well. So like Starbucks hires, I can't remember the company's name right now, Steritech, I believe. So they go around to all the Starbucks and audit stuff so that keeps the startup, all of the Starbucks franchises on their toes, so to speak, right? And then amongst the health agencies, there are also non-public health inspector jobs that you would qualify for, like health promotion and health education, that kind of thing. And there are some private consulting companies that do that as well. So that's sort of the general employment opportunities that you will find after graduating from this program. Testimonial, so this is that. I'll just read this quickly. So what he says is, as an alum of the BCIT Environmental Health Program, I work as an environmental health officer for Fraser Health. So I'm currently working to keep local restaurants, personal service establishments, and pools in my district up to date and with the ever-evolving COVID-19 pandemic information. So when my son was born March 16, 2020, I took 2 weeks off to be with him and my wife, and now back to work at this rapidly changing time. My colleagues and I are now preparing to be redeployed. So this is a little bit out of date. He has already come back to his office, but he says, my colleagues and I are now preparing to be redeployed to a case and contact management hub to assist with the case and contact tracing of COVID-19, changing hours, duties, and location. Be smart, be safe, and I hope we will not be calling you. So what this does bring up, Zach's testimonial does bring up, is during the pandemic, when you hear the term health officer, or when Dr. Bonnie Henry is going out there saying public health is going to go out there and do this, do that, the majority of those actions are being taken by environmental health officers. They are the health officers out there. If you look under the Public Health Act, there's only two types of health officers: medical health officers and environmental health officers. Medical health officers are doctors, so public health doctors, and there aren't that many of them. So they will be the one generally like signing the big orders, doing the big press conferences, that sort of thing. But the boots on the ground are the environmental health officers. So you will also be charged with enforcing the Public Health Act. So a lot of those actions are being taken up by graduates of this program, right? Next slide, please. So admission and how that works. Next slide, please. I think all the stats are in the next one. So the start date for intake generally starts on October 1st, and it's open until the program fills up. So it says applying early is recommended, limited seats are available, and I think I mentioned there are 26 seats. The start of the program then becomes the September of the following year. So right now, we still have a few seats available actually. So if you wanted to apply, the application window is still open, and the start date would be September 2022. Next slide, please. So application steps, how that works is go onto our website. We have all of our entrance requirements listed on there. So review the requirements and application dates. Remember, applications open on October 1st. And then convert all the appropriate files to PDFs. We have a questionnaire that we ask you to fill out. So that questionnaire has information such as recent experience and the grades that you have, the courses that you have, etc. And we actually also ask you to go speak with an environmental health officer in your community so that you can get a better idea of what they actually do, right? Hear that information straight from the horse's mouth, so to speak. So that is also part of the questionnaire. So once you gather all of that information, you can then apply on the BCIT website. Next slide, please. So here's an overview of our entrance requirements. So proficiency in speaking and listening English, of course. So we're asking for at least 2 years of full-time education in English in an English-speaking country or equivalent test or course. 3 credits of post-secondary English or humanities or social sciences, so at least 67% from a recognized institution from an English-speaking country, and then 60 post-secondary credits. So that can include at least 18 credits at a second-year level in at least 2 subjects. We need a biology course, we need a chemistry course, and then 6 additional credits of science. So it could be biology, could be chemistry, could be physics, etc. So then in our self-assessment form, we ask that you have a discussion with a public health inspector in your area to get a better idea of what the career is actually about. And then a minimum of 1 year of full-time or accumulated part-time relevant work experience. So relevant, what we deem relevant is basically, are you interacting with the public? So for instance, if you are working at a job doing customer service, that's great. That teaches you how to deal with people. But if your 1-year job was, let's say, landscaping, then that's probably less relevant because you're working not with the public, but just maybe with a partner or maybe a small team, and then you're out, doing landscaping. So that experience wouldn't be as relevant to what we're looking for. You do need a driver's license and then access to a vehicle. You don't need that during the course, but you need that during your practicum. you typically have to drive around yourself on your practicum, and you typically need at least a Class 5 license. So if you have a Class 7 or your N now, once you enter the program, that should give you sufficient time to get your Class 5 by the end of the program. Next slide, please. And then the rest is just talking about how to upload your documents to the website. So option 1, scan and take a picture of the official transcript or an upload, or download your digital transcript from your school and upload. So mailing in transcripts is not recommended. But if you are already an existing BCIT student or past BCIT student, you don't need to upload your transcripts because we will already have access to them. Next slide, please. So once you upload your data, your information, the admissions team here at BCIT initially reviews your application to ensure that you meet all the basic requirements. Then the applications come to me as the program head, and I will review your self-assessment form as well as just do a double check on everything, making sure everything is okay. And if everything is okay, then admissions sends you an acceptance letter saying you've been accepted to the program, and then you will be asked to pay a commitment fee at that time. Next slide, please. So, laddering in terms of credentials. So once you graduate from our program, you will have a bachelor's degree. So some of you will be coming in with a pre-existing one, whereas this one might be your first bachelor's degree. Then many people go on to do their master's. So it might be a master's of public health, master's of public administration, etc. Lots of people take different programs. Some people rely on their past degree to do those masters, and some people rely on this degree to enter the master's program. Generally, that hasn't been a problem or an issue. So if you're concerned about, bachelor's of technology, will anybody recognize that? That generally has not been an issue for people graduating from the program. And people doing their masters are generally thinking of stepping up in their career, right? Going into management, going into project work, specializing in something. So, but it's not strictly necessary to be an EHO to have any further degrees. Next slide, please. Supporting your success. Julie, correct me if I'm wrong. Generally, do you cover this section?
Yes, I can.
Yes.
Hi, everyone. I'm back. Okay, so supporting your successes. So BCIT takes a holistic approach to student life. We want you to succeed not just in your academic work, but also in your as a person, as a human being, to make sure that you have the supports to be successful. So there's Indigenous services for our Indigenous students. There's a gathering place. There's a whole team of people that can help you on your academic journey here. Student financial aids and awards, accessibility services, student health services. There's an actual medical unit on campus with doctors and nurses that can see you if you have any issues. So it's a fully functioning clinic. There's counseling and student development, and there's rec services with a fully functioning gym and showers on campus. You're going to get this PDF, and there's links to more information about this, but there's definitely a lot of support on campus. Janice, I'm not sure if you want anything to add on there. And the next slide is connecting with us, program advising. This is their phone number. So you don't have to rush to take screenshots. You're going to get this slide deck and a recording. They are available by phone, drop in, email. Okay, so this is the most important information that you need when starting your application journey here with us.
Sorry, Julie, I wasn't able to get the mute off quickly enough. So yeah, if I could just echo what Julie was saying, not so much commenting on the student success slide, but if you have any questions regarding the entrance requirements, often there are questions because the entrance requirements are asking for some post-secondary as well. So certainly don't hesitate to connect with program advising. We're available to you by email, by telephone, virtual drop-in, as well as in-person drop-in. So we'd love to talk to you further about meeting those entrance requirements for this program.
Thank you, Janice.
Thanks, Julie.
And here's our social media handles, Facebook, Twitter, Instagram, YouTube, and LinkedIn. If you're on any of these platforms, I encourage you to join our community on them. We post videos, we share information about programs, things that are happening on campus, future events. So a lot of good information comes out of there. There's a few websites. The tours, if you wanted to tour the campus, spend a day, find out more about our big info sessions, which hopefully will be back in person this fall, information sessions in general, and advising. So take a look at this slide. I encourage you to join our social community. Questions and answers. So I'm going to stop share so I can go into the chat. There we go. And let's take a look here. I'm going to start. So I had a question. I don't have a graduation degree in science and I don't have 60%. Is there any chance to become a health officer? I have science in 12th grade only.
I would recommend that you go and do at least the first year biology and the first year chemistry to meet the minimum requirements. And you do need 6 additional credits. We are a science-based program, so when a lot of the material is taught, the science-based material is taught, we kind of go in with that assumption that you have that basis to that grounding of a science grounding. So it will be really challenging for you to pick up on the principles that a lot of things that we talk about rely upon if you don't have that science background. So as far as I know, every other environmental health program in Canada has that. There are some programs out there for you where it's a 4-year program. They basically you start from as a high school graduate and go from there. But unfortunately for our program, you do need those post-secondary science courses.
We're going to take one more question and then we'll actually play that video that we have. Erin has it queued up. So we'll have a chance to play that video and then you can post your questions while the video is playing and we'll address them. Just one more question before we start. How many of your graduates find work as environmental health officers?
So right now, things are up in the air, a little bit in flux. And what I mean by that is because of the pandemic, past couple of years, there has been huge demand for environmental health officers. So basically every person who graduated within the past 2 or 3 years that was looking for a job got picked up by all the health authorities because there was that huge demand for jobs. Right now, I don't know what the future looks like because I think it depends a little bit on the pandemic and what's going to happen and how much funding is left. In a normal pattern, I would say the vast majority of people that want to become environmental health officers become environmental health officers. However, some people, the caveat on a normal basis, the caveat there is that you do need to be prepared to move. Right? If you're somebody who says, I can only work in Vancouver and Burnaby and don't want to go anywhere else, that becomes very challenging because you're restricting, your job options quite a bit. The need for environmental health officers is spread out throughout the province. So if you're somebody who is willing to move or even go out of province, then I would say the chances of finding jobs are very, very good. But if you aren't, willing to do that, then it does become challenging normally. That being said, like I said, past couple of years, Fraser Health hired everybody basically, so it didn't really matter where you wanted to go. You were able to find a job. So, but I just don't know if that's going to be going on, forever, sort of thing. Mm-hmm.
How strict is the 1-year work requirement? Are there a certain number of hours needed?
There aren't any specific hours. I do take a look and see basically what is it that your experience actually is. All right, and then make a judgment call based on the application. So I'm not counting up, oh, you did 3 months there, and then 3 months there, and then 2 months there, and I'm trying to add all those numbers up. I'm trying to see, okay, this person spent a year working in a restaurant. Okay, this person spent 2 years working part-time at a front desk agent somewhere, that sort of thing, and go from that. If I do have questions, I tend to email the applicant directly and just say, can you tell me a little bit more about your work experience? I'm trying to make an assessment of that. So I wouldn't say it's very strict, but I do look at each applicant on an individual basis.
We have another question. If I need to do some prerequisites, how can I get in BCIT?
So if you need to do prerequisites, let's say you're missing a lot of the post-secondary requisites, BCIT unfortunately doesn't offer those courses because we're the institution itself. We don't provide like generalist biology courses or chemistry courses outside of a specific program. So you can do them anywhere really, right? You can go to Langara, you could go to Douglas, you could go to Kwantlen, you could go to UBC or SFU to do those courses. Those are all possibilities as long as it's an accredited school that would be recognized by BCITs. So there are many choices. It's hard to say exactly what you need without knowing more.
I could just add to that, Dale. Definitely, if you've got questions about upgrading or ensuring that you meet the specific entrance requirements, connect with a program advisor, because we can sit down with you and sort of step by step go through what you need to prepare for to be ready to apply to the program.
We have another question. Hi, I completed high school and university outside Canada in Germany, and I was wondering if my first step would be credential evaluation to see if I meet the 60 credit threshold. I basically don't know if any courses I took during my 4-year degree studies are transferable to BCIT.
Janice?
I definitely, again, to connect with a program advisor. Often post-secondary, out of country post-secondary and high school is accepted. So what you will probably have to do when you apply, definitely I would say an international credential evaluation will need to be done. But we'll also probably need course outlines for the specific courses that Dale would be looking at, just to ensure that the content of those courses are a close match to what he's looking for. So it would probably be a bit of a combination of both to ensure that the post-secondary you did out of country meets our post-secondary, but often it does, absolutely.
Yes, and I've seen some of those international evaluation reports, and they seem, like you said, they often seem, no problems there. Just a few additional steps to jump through.
What you do need to remember, though, that report, it does take time, sometimes 6 to 8 weeks to have your documents evaluated. So make sure that you give yourself plenty of time, turnaround time, to get those done in time for the application period.
Okay, and Julia said thank you. Do we have any other questions? I don't think we do. I'm just going to share my screen to put up your emails once again. And are the 2 most important emails that you need to continue your application process, or if you need to know more information. Dale Chen, who gave us this presentation, and program advising.
And Julie, before we sign off, I think I should clarify one thing, because it got mentioned a few times and I sort of skimmed over it when I spoke. It's certification. So to work as an environmental health officer in most jurisdictions in Canada, you do need to be certified, and that certification is given by the Canadian Institute of Public Health Inspectors, and they accredit us, BCIT, as one of the programs where you graduate from that can be eligible to sit the certification exam. So it's a combination of 2 things: graduation from one of the certified accredited programs, as well as the 3-month practicum. So doing the program here, well, you get both, right? You graduate, you get your degree, you become eligible, and then we also arrange for the practicum for you. You meet the other side of the certification. So that's just something to keep in mind as well. But once you graduate and that certification exam, you are on your own in terms, or not on your own, it's like we provide as much support as possible, but you are more responsible for yourself in order to make the proper applications, put your packages together, etc., and apply for certification. So I'm pretty familiar with the process. I was a past president of the BC branch of the Canadian Institute of Public Health Inspectors. So if you do have other questions around that, I can try to direct you to the right people as well. But that is something. That certificate is Canada-wide, except for Quebec, because they do things differently there. But every other province in Canada recognizes that certificate as for environmental health officers. Thanks.
Okay, and with that, I'd like to thank Dale for his excellent presentation. And I'd like to thank Janice from Program Advising for being here and answering questions with us. I'd like to thank Aaron, who had to sign off, but luckily helped us with our technical glitches
Yeah.
and shared that video. So please look out in your email for a note with this video recording and a PDF of the slide deck. Thank you everyone for attending, and have a great sunny day.
Thank you very much.